Are you wondering if your child is experiencing nightmares or night terrors? Looking for some tips or tricks to potentially help you through this tough time? On today's episode, we're going to talk about the difference between nightmares and night terrors and go through some tips and tricks to help troubleshoot this area.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
So we're back in the office today at Be Kind Pediatrics, and I want to talk a little bit today about nightmares and night terrors. Halloween is coming up upon us, and so I think it's a good time to talk a little bit, especially about nightmares. Let's start off by talking about what is the difference between nightmares and night terrors. Both are sleep disturbances, and most often these sleep disturbances start in toddlers or young school-age children. The biggest difference between nightmares and night terrors is one, the child's behavior during it, two, if the child remembers it, and three, how hard are they to get back to sleep. So night terrors are parasomnia, similar to sleepwalking, for example. And they occur during stage 4 of sleep, which is a deep sleep stage. And so they typically occur earlier on in the night because that is when we are generally in stage 4 sleep. So they're usually happening sometime before 2 a.m. And they can be consistently happening at the same time every night. They can start as early as 2, 3, 4 years old, though typically closer to that 4-year-old age. And what it looks like is that the child is almost, for lack of a better word, violent or very, very frightened, but they often don't respond to the parent because they're actually asleep. When a parent does wake them up and they're managed to arouse them from this deep stage of sleep, the child frequently does not remember the night terror and they go back to sleep very, very easily because they don't remember being terrified or scared. That is in contrast to nightmares, where children usually do remember the nightmare and they're very hard to get back to sleep because they remember it and are feeling scared. So night terrors can look frightening, and they are often very frightening for the parent to witness, but the child is seemingly kind of unaffected by them. The real treatment for night terrors is kind of twofold. So one, sleep deprivation or being overly tired can make you spend more time in stage 4 sleep or deep sleep. So you want to really try your best to avoid having your child be overly tired because that might actually make them spend more time in stage 4 sleep and have more night terrors. So that is the best way to prevent that is having a really strict sleep schedule where they're going to bed at the same time and waking up at the same time and having a really solid sleep routine. And we can talk separately in another podcast maybe about sleep routines and promoting healthy sleep habits. So the second part of treating night terrors is really prevention. Again, often if the night terror is happening at the same time every night, what I encourage parents to do is actually to arouse the child slightly 15 to 30 minutes before the typical time that they have their night terror. And that is to kind of break the cycle of them having a parasomnia in stage 4 sleep. And you do this for about 2 to 4 weeks. If you're not sure exactly what time this is happening at, usually children enter stage 4 sleep around 90 minutes after they go to bed. So you can try just gently arousing them, not fully waking them up, but gently kind of getting them into a slightly awake state, 15 to 30 minutes prior to that 90-minute sleep time, or 90 minutes after they've gone to bed, or again, 15 to 30 minutes before they usually have a night terror. And the last thing to really consider with night terrors is if a child is on any type of medication, particularly some of the over-the-counter medications like diphenhydramine or Benadryl, can increase the frequency of parasomnias, specifically night terrors. So just reviewing the list of medications that your child is on, both prescription medications, over-the-counter medications, and supplements with your child's healthcare provider to ensure that there isn't a medication that has a side effect of night terrors. So what do you do if you believe your child is having a nightmare and not a night terror, and what is the cause of it? So we don't know exactly what causes nightmares, although we believe it has something to do with the emotional processing of something that happened during the day. Sleep is kind of like a detox for our brain. It's the time where we undergo a lot of detoxification from a chemical process, but also where we process a lot of our emotions from the day. So we believe that children who are having nightmares are dealing with something or processing something that happened to them during the daytime. And for most children, you can identify a stressor from their life or, that recently happened in their life that's affecting their sleep. Statistically speaking, actually, the most common trigger is something that they saw on TV. And that can be something that they saw with you, or they saw at a friend's house, or maybe that they saw on their cell phone. It can be a story. It can be a life stressor, such as the loss of a loved one, a big change in the family situation or home situation, moving, a new school. These are all possible stressors for children. So trying to identify the acute stressor can also be helpful. And we'll talk a little bit more about that, why that is later on. And then, in today's current geopolitical climate, also things that they might hear parents talking about, or parents talking about with their friends, or that they might have seen on the news. So just sitting down with your child and trying to identify what might be the cause of some sort of emotional stress for them, again, can be super helpful later on. What can you do if your child is having a nightmare? So the first thing is prevention, and that's really encouraging sweet dreams and sticking to a really good sleep schedule. Because as we mentioned for night terrors, again, being overly tired will allow your child to spend more time asleep potentially and increase the frequency of their nightmares. Now, nightmares tend to happen in REM sleep or light sleep, which is different than, again, night terrors, which happen in that deep sleep. So in light sleep, children tend to remember them. They tend to be a little bit more difficult to get back to bed because they do remember them and are scared. So let's start with the bedtime routine. Really encourage your child to go to bed at the same time every night. Again, waking up at the same time every day, which can be challenging with school and activities, but just try your best. And then having a really solid sleep routine. And you might want to make some acute changes to your sleep routine to, again, encourage sweet dreams. So the first thing is reintroducing a lovey, potentially either a stuffed animal or something that is comforting to your child. Reading calming and relaxing stories, having calming and relaxing music. You can even use a little bit of lavender in your nighttime routine. It is okay to spend a little bit extra time in bed with your child before you go to sleep, as long as your child is still going to sleep awake on their own. If your child is calling you back into the room frequently because they're scared, a helpful technique can be to discuss with your child ahead of time that they are going to get one call back and that you want them to address all of their needs in their one call back. And so your child can call you back into the room at any time, but just once. And setting really strict and clear boundaries while still being present and emotionally available for your child can help them feel safe and secure, while also making it clear that they can't call you back into the room 4 or 5 times. So that is one strategy if your child is kind of frequently calling you back into the room. You can also consider incorporating into your bedtime routine a tool for your child, especially if they're at an age where they're particularly imaginative, that helps them get rid of their bad time nightmares. So I like to use a flashlight, and you can really get into imaginative play with your child at this age and encourage them to turn on their flashlight and flash it around the room, and that will help them ward away all their bad nightmares. Another great tool is a dream catcher. So again, nightmares tend to occur at an age where children are starting to really engage in their imagination and magical play. I mean, you can really use that to your advantage. So having a dream catcher above their bed and explaining to your child that it's going to catch all of their bad dreams can be a really helpful way to encourage your child that they are going to be safe and not have nightmares. On the same kind of line of the imaginative play, another technique I like to share with parents is kind of the bad monster spray, specifically if your child is having nightmares about monsters. So you can just fill a water bottle, a spray bottle with water, spray it around the room, and tell your child it's monster spray, and that's going to prevent any of the monsters from getting into their room. You can open the closet, check under the bed, tell them that you've checked everywhere and that there are no monsters in their room. If you have identified the specific stressor, so for example, let's say there was a big change in your life where all of a sudden now mom is traveling frequently for work, and that seems to be something that your child is struggling with. I encourage you in that situation to talk about that during the daytime with your child. And a really helpful technique for helping children understand something like this is to just I recommend getting a bunch of children's books actually. So there are children's books about a lot of these topics now. So you can get children's books explaining why mommy is traveling for work, that mommy is going to come back, always going to come back and be there for you, that mommy loves you, these types of books. And exposing your child to the idea and talking about what's going on can be super helpful for them in helping them conquer and understand what's happening, and also understanding that their parents are going to be there for them physically and emotionally at the end of the day. So what do you do if your child is waking up and coming into your room from a nightmare? This is a really challenging situation for both parties. One, because most parents are already tired and dealing with fatigue, and then they're being woken up by their child. And then secondly, their child is waking up and having a sleep disturbance, so they're increasingly tired and fatigued as well. And there's a couple strategies to handle this. Some parents don't mind the child coming into their bed and sleeping at night. I try to discourage families from doing this because over the long term, I think it leads to poorer sleep outcomes for both the child, most importantly, and also for the parent. But if you are really, wanting to have your child in your room when they're having nightmare, what you can do is explain to the child either to come in and not to wake you up and quietly kind of climb into bed, or you can set up a sleepy corner for them in your room, like a special sleep mat or sleep sack in the corner of the room where they can come in and sleep without waking you up. That would, again, it's not my first recommendation because I think over time it affects the sleep quality for the child. So what I prefer is that if your child comes into your room scared, you directly walk them back to their bed in their room, and then you do all of the reassuring in their room. So give them a big warm hug, physically embrace them so that they feel warm and safe. Tell them that they're okay. If they're scared of something in particular in the room, show them that there's nothing in the room. Stay with them until they're calm, and then immediately go back to your room once they've calmed down. Again, the process is to quickly kind of get them back to their room and try to spend the least amount of time outside of their room as possible. And then I encourage the parents the next day to talk about whatever they were scared of. So try not to spend a lot of time at night discussing it. Just reassure them that they're safe, that you're here for them. And then in the morning, like again, if specifically the concern is monsters, try to talk about that, spend 15 minutes in the morning discussing their fears and reassuring them. The last kind of thing I want to mention as sleep hygiene, and in this section particularly, is avoiding screen time before bed. So try really your best to avoid any screen time, any homework, anything that might make your child stay up later, at least an hour, 2 hours for screen time, and probably an hour for homework, so that they are having a nice, clean sleep hygiene routine. And I encourage parents, especially of older children who are having nightmares, to remove the TV if they have a TV in their room, and to do homework. If they're doing homework at a desk in their room, try to do homework outside of the room so that the room is really just used for sleeping, and it's a nice clean space when they enter the room from a mental standpoint of just sleep. And I also want to take a second to talk a little bit about how to talk to your child during the day about their nightmares. So first, you want to reassure your child that it's okay to be afraid or to feel sad or to be stressed out about whatever is going on in their life, or to be scared if they're scared of monsters. That's totally an okay feeling, and you really want to validate their feelings. So validate their feelings, let them know that it is okay to be scared, but that they are safe in their bed and that you are here for them, and try to just use a little bit of like an extinguish therapy. So exposing them to whatever they're scared of and trying to redirect that fear. So another example is maybe they saw a scary movie about a dog. For example, you would want to say, it's okay to be scared. You know that you're safe in your bed, you're safe in your home. And then maybe taking them out to see a few dogs that are well-mannered, just spending some time with the dog at first. Then maybe after a few sessions of just being around dogs, encouraging them to touch or pet a dog. showing them that it's safe by you petting the dog first, and do slow amounts of exposure to whatever it is that they're scared. So maybe 5 minutes every day and going a little bit further every day until you've helped them adjust to that fear. So what do you do if you've tried all of these things and your child is still having a nightmare and you're exhausted and they're exhausted? At this point, I really encourage you, even at the beginning of the nightmares, to reach out to your child's healthcare provider and seek additional solutions, potentially additional therapies for your child. I would also encourage, if you think that your child is having night terrors, to reach out to your child's physician just to make sure that there's no other sleep disorders going on or other parasomnias that your child is experiencing. They can be a great source of additional ideas outside of the ones that I've shared with you. They might help you evaluate, like I said, for any medical medications, supplements, or over-the-counter medicines that are interfering with your child's sleep. And they can be really helpful in providing you additional resources like counselors, therapists, and sleep trainers if needed. So I hope this episode was helpful, especially to any parents out there who are feeling particularly exhausted or overwhelmed by their child's nightmares. It's a really challenging time in a parent and child's relationship, but I encourage you to reach out to your community and your healthcare providers. We're here to help and support and get you through this.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.